Good morning, everyone. My name is Neha Thakur, and the topic of my discussion for Decade of Diagnosis is women's health before, during, and after childbirth. And the decade I'm going to present is 1980s. But to be true, it's 1970s to 1989, which is known as a time where a lot of revolutionary changes were made in this field. And even the US Department of Agriculture, it developed the WIC program to make sure that all the supplemental food requirements have been provided to the women, child, and infants. 1980s specifically is known as a phase where there were a lot of concern about spontaneous miscarriages, preterm labor and deliveries, complex neonatal care, and a lot of respiratory distress in infants. And later on, they were concerned about the puerperal fever in women after delivery. So let's put everything in the specific way. So the first concern was the lower birth weight of infants. And for that, there were a lot of studies and recommendations, like Food and Nutrition Board, it recommended that the ideal birth weight has to be 10 to 12 pound of infants at birth. Then some scientific studies, it showed that the second or third trimester is the time frame where the lot of the food and nutrition diet can impact the growth and development of infant. And there were studies which also shows that how smoking and drinking and even the caffeine from coffee could have a detrimental effect on infants. And so there were a list of do's and there were a list of don'ts for a pregnant woman, and there were a lot of awareness and publicity about what and what not to do. This is also known as a phase where there were the development of prenatal medications, because studies depicted that all the nutrition can be provided except iron in the pregnant woman, which is a must. And to fulfill that required quotient, they started having these prenatal medications, and there was a complexity related to those medications because given that 1980s recession where not everybody could afford those medications or that nutritional care, there was a lot of federal financial support given to the families to make sure everybody is able to attain it. But it was not until earlier 1990s that WIC program could provide 100% those medications could be provided to women like in 100% scale. But still, as per studies in 1989 shows, approximately 70 to 80% of pregnant women receive those prenatal medications. So this did show a lot of change, and there was a lot of brighter and improvement in the infant deliveries where they were having normal deliveries. But suddenly they came across another trend where there were more of pregnancy-related complications and delivery complications related to the forceps, or more of cesarean surgeries because of bigger size of the fetus. And so more women were asked or moved towards the hospital surgical deliveries. And then suddenly there was a trend seen that the women who's coming in for surgical procedures, they are ending up getting a puerperal fever, and which ultimately led to the demise of a woman as compared to the women who were delivering at home. There were also some researchers which says that people started talking about that puerperal fever being the fever of a rich, because they are the one who could afford all the nutrition diet, they are the one who could get all the prenatal care, and they are the ones who can actually afford and go to the hospital for the treatment, as compared to the poor woman who could not even afford all that stuff and ending up going to a midwife for deliveries. So there was a lot of gap, and there was a lot of studies and research needed to be done. To fill up this gap, Food and Nutrition Board in 1987 developed a committee which is known as the Nutritional Status Dietary and Nutritional Status during Pregnancy, Dietary and Lactation. So this committee found some great recommendations and a lot of researches were done to fill in this gap. But there was a long way it was a long way to go. It was sometime in 1990s then that we actually were able to reduce the range of this puerperal fever and given more education um, to people about how to get rid of this fever. But while doing this presentation and all the research, I did find it very interesting that we have come so far along this time, and with a lot of research and education, and into this gone into this field, that even today we see in hospital the cases of puerperal fever, though they are 100% curable nowadays because of antibiotics. But it is something that just stays with you as a woman, that it's been known from like so long and so long ago, and still there is something that we are struggling with. I know, being a woman, or working in a hospital, that every cesarean surgeries, even today, that we do get a shot of antibiotics just to make sure that it has been saved, and they don't have a case of puerperal fever, irrespective of fact how sanitized and how hygienically clean our instruments are. So that is something I take away or keep with this research, that we have come a long way, but it is still a long way to go. Thank you.